a lot of the times people who are experiencing this type of abuse might not recognize it, might not know that it's actually happening to them. They might see it as being, part of a bad relationship, or just, someone, their partner really, really wanting a child, but not recognizing the coercive nature of it, or not being able to actually put words to the experience of it as a type of abuse. Reproductive coercion is anything that is a deliberate attempt to interfere with someone else's ability to make decisions or choices about their own reproductive health. So anything that somebody or a kind of a system might put in place to try and block somebody's ability to make their own decisions. So one example might be contraceptive sabotage, which is kind of interfering with contraception in some way. So maybe removing a condom during sex, or poking a hole in a condom, or hiding someone's contraceptive pill. The other might be pregnancy pressure or coercion. So this might look like putting pressure on someone to become pregnant, to remain pregnant, or else to terminate a pregnancy. And then it can also show up in blocking access to sexual and reproductive healthcare services. So not allowing somebody to go to the GP to access contraception, or insisting on accompanying someone to a healthcare appointment to try and interfere with their ability to ask for contraception or advice about their reproductive health. Because it's quite a new term in the literature, it's not something that's been very extensively studied. There's links that are appearing in the research between this and other types of violent behaviour, so like intimate partner violence, but the exact way that they interact and co-occur is not very well understood. And that creates an issue in terms of developing really targeted interventions or screening programs. So what we wanted to do was to try and interview people who worked in this area to try and really tease apart the link between reproductive coercion and intimate partner violence. So while reproductive coercion is something that plays out at an interpersonal level, it's something that's identified as being perpetrated usually by a male partner against a female partner. What our participants identified was that it's really influenced by things that happen in the community as well. So things like socio-cultural norms and values, so ideas about gender roles and the place of women, ideas about preferences for having a male child or preferences for having multiple children. One of the things that came up in our research as well was the influence, for example, of the Catholic Church and the pressure to reproduce and have a lot of children, and the pressure not to use contraception. And that these kind of social norms can be things that allow reproductive coercion to go unnoticed and unnamed, and they create an environment where it's kind of accepted. And another thing that was noted by our participants was that the normalization of gender-based violence and the normalization of violence against women was also something that allowed reproductive coercion to kind of go unnoticed. Reproductive coercion is often something that has a disproportionate effect on marginalised women. So our participants highlighted that women who are migrants might experience additional barriers to being able to either identify or report reproductive coercion. So things like language barriers, lack of familiarity with healthcare services and referral pathways in Ireland, and a lack of awareness about the legal provisions and rights that they have access to in Ireland. They were all things that created additional barriers in terms of disclosing reproductive coercion for these women. Something else that they identified as an issue as well was a fear around deportation, so that this was something that perpetrators of the abuse might use against the victim to kind of increase their control over her. There are no kind of legal protections for this at the moment in Ireland. So that's something that is a big issue, and that we can't kind of provide any legal protection for people who experience this. And it also impacts our ability to collect accurate data on it, because it isn't integrated into our screening programs at the moment. It's not integrated into our sexual health services or our domestic violence services. So that leaves really big gaps in our knowledge. So interventions can happen at various levels. There might be perpetrator level interventions where the goal is to try and reduce that behaviour in somebody. There can also be community level interventions, so things like education around what is reproductive coercion and education around, harmful gender norms and stereotypes that might contribute to this type of behaviour. And then interventions that are more aimed at supporting people who've gone through this experience. So maybe, counselling and psychotherapy interventions that, are really there to address that specific experience, or just practical supports for people in terms of what are their rights and what type of action can they take if this is something that they've experienced. It will be important to try and integrate, screening for reproductive coercion into maternity healthcare settings, for example, and into gender-based violence settings, so that we can try and capture that experience when people are going through the services. After speaking with healthcare providers around Ireland, we know now that this is something that they see in their day-to-day practice. This is happening, and hopefully we can now go on and do more kind of specific research and more in-depth research on this, so understand not only providers' perspectives but the lived experiences of people who have gone through this, and with that, increase in knowledge, try to develop more targeted interventions and screening tools that can help support people.